This is Dr. Ryan Bell with Yada Yada Health. Let's talk about teething. Teething is a process that all children will go through. It can be very aggravating for them and for us as parents and practitioners. Some of the basic things to understand about teething. Teeth can happen anytime. I've had patients born with teeth. I've had patients who are still at 15 to 18 months of age waiting for a first tooth to come in. So there's a big range there. We tend to not worry about them on either end of the spectrum. Usually if kids get close to that 15 to 18 month time frame with no teeth, I'll usually recommend they get in to see a dentist. But the dentists have passed along that those teeth tend to stay healthier the later they come in. So if your baby is an early teether, there is some silver lining there. Teeth usually start, the bottom middle incisors are typically the first ones to come in, followed by the upper interior incisors. The incisors just lateral to those are usually the next ones in, and then you usually skip to the first set of molars. Canines fill in between those two, and then usually between 2 and 3 years of age, you'll get your second set of molars. The pattern with teeth doesn't really matter much. Some kids haven't read the book and their teeth come in a different order, and that's fine. It's always cool if they get those corner teeth in first and they look like little vampires, but there's really no specific concerns as far as the pattern there with teeth. Even before a child has their first tooth, you can get in good habits by just taking a wash rag or even a clean finger and just wiping down their gums with a little bit of water. Once teeth erupt, we would recommend starting to clean them off, especially at night after they've had their last breastfeeding or their last bottle, to try to get in there and clean those teeth off good. To start with, you can even use a wash rag as they get more teeth. Transitioning usually 9 to 12 months to a toothbrush is a good idea, and we'll usually use safe to swallow toothpaste until they're about 3 years old, and you can teach them to consistently rinse and spit. Another common question we get with teeth would be the need for fluoride. So depending on the area you live in, a lot of places have fluoride in the drinking water, and you don't have to worry about supplementing fluoride. Where we live, we don't have fluoride in the water, so the dentists recommend children be on a fluoride supplement of some type, usually between 6 months and 5 years plus in age. Usually seeing a dentist is a good idea at around age 2, in my opinion. There's some debate on that. I'll send kids to the dentist earlier if there's any specific worries or problems or bad family history with teeth. But generally, if teeth look good and parents are able to do standard things to clean and take care of those teeth, I usually recommend they start seeing a dentist around the age of 2 years old. You can also start to floss at any point along the way. Hopefully your child will cooperate and let you do that. What can I do to help with teething? So it is somewhat age dependent. Children under 6 months of age, Tylenol tends to be helpful. You can do Tylenol every 4 hours. You can try to find something that your child likes to bite on, a cold, clean washcloth, or some type of toy that you can get cold that's going to be safe for them to bite on. People will even use food like frozen fruit, especially if you've got some netting there that they can chomp on safely. Those things might feel good. Some kids just don't want anything to touch their gums at all while they're teething. If your baby is an early teether and you're breastfeeding, that can be problematic, can be painful. One trick that seems to work very well is if that baby bites while breastfeeding, instead of trying to pull away, pull that child in to the breast. The baby won't be able to breathe. They'll let go. They'll learn really quickly that they can't bite while they're breastfeeding. Kids 2 years and older, so typically that's just going to be with that last set of molars. you have the option of using a benzocaine gel or paste, something like Oragel. We don't recommend using those products in children less than 2 years old. There is a risk of them getting too much, of it numbing the back of their throat and causing serious trouble with swallowing and aspirating. We also don't recommend the use of chamomile or other similar products. They've been shown to be damaging to gums at times. And so stick with those things that are approved and talk to your provider if it doesn't seem like your baby's getting enough relief with those things. We can see kids have what are called eruption cysts at the site of a tooth coming through the gum that will be swollen, black or purple. They can be pretty impressive. There's really no specific treatment for an eruption cyst other than giving it time, trying to control pain, and allowing that tooth to come through the gums. They disappear usually once the teeth erupt. Teething tends to be worse at night. There's a couple of theories for that. One is there's less to distract your baby, there's less going on, their attention's focused more internally. There's also some arguments that as your body's adrenaline and cortisol levels cycle down as evening comes on, that it makes you more responsive to inflammation and pain. But it is a very common thing for that teething pain to be way worse during the night. I usually like to do a dose of ibuprofen in a child who's above 6 months of age as they're going to bed, and that should last 6 to 8 hours and give them pretty good pain relief through that most sensitive time. Teething should not cause a fever. If your baby's temperature is above 100.4, be very suspicious that there is some type of an infection going on with your baby, that it's more than just teeth. Kids generally will be warm when they're teething, 99, 100 degrees, but if they get into that 100.4 plus range, be suspicious that there's something else going on. And that's a basic review of teething in the pediatric world. I hope it helps, and happy teething.